Good afternoon, and thank you all for being here on this Wednesday afternoon in early December 2020. We're seeing a tremendous amount of COVID-19 spread across our country and across Mississippi. As I've been saying, this is a very dangerous time. We are close to a vaccine. We can see it in the near future, but we are not there yet. And we need to bridge the gap from today until that vaccine or those vaccines are readily available. Our current executive order is set to expire on Friday. And I want to explain to you what our new posture is going to be. First, we strongly encourage everyone to wear a face covering. Avoid large gatherings where you can, especially those that are indoors. Maintain social distancing. Practice good hygiene. Wash your hands. And stay home if you feel sick. Social gatherings where distancing is not possible will be limited to groups of no more than 10 in a single space indoors and no more than 50 in close proximity outdoors. That will apply in all 82 counties of the state. Face coverings are required in schools statewide whenever it is not possible to maintain a minimum of 6 feet of social distancing. They are also required while indoors and interacting with the public in any counties that meet the objective criteria we laid out months and months ago. Those counties are as follows: Adams, Alcorn, Amite, Attala, Bolivar, Calhoun, Carroll, Chickasaw, Choctaw, Clark, Clay, Coahoma, Copiah, Covington, DeSoto, Forest, Franklin, Grenada, Harrison, Hines, Holmes, Itawamba, Jackson, Jefferson, Jeff Davis, Jones, Kemper, Lafayette, Lamar, Lauderdale, Lawrence, Lee, LaFleur, Lincoln, Lowndes, Madison, Marion, Marshall, Monroe, Montgomery, Neshoba, Noxubee, Oktibbeha, Panola, Pearl River, Perry, Pontotoc, Prentiss, Rankin, Scott, Simpson, Stone, Tate, Tippah, Tishomingo, Union, Washington, Webster, Winston, Yalobusha, and Yazoo counties. With the new EO coming into effect, our old one having been ready to expire on Friday, if you take the 54 counties that were under the mask mandate, we basically added 12 and eliminated 4 because those 12 met the criteria that we had set forth some time ago, and the 4 did not. Businesses across Mississippi are asked to make good faith efforts to comply with COVID-19 rules and guidelines, including social distancing and regular sanitation. Restaurants and bars must ensure at least 6 feet of separation between each group and have no groups of more than 10 in any one party. One new challenge that we need to address in this new season is the rise of indoor sports. Now, I've always been a defender of the fact that it is necessary for these kids to have access to the structure and to the opportunity of athletics. I firmly believe that for a lot of kids around our state, playing ball is the primary reason they work so hard to keep their math grade up. Now, when they look back on it 20 years from now, they may determine that, hey, that probably wasn't that smart. But maintaining eligibility certainly is a motivating factor for ball players all across this state. Having said that, we do have to recognize that there is more risk to large indoor gatherings, such as basketball, than we had in those fall outdoor sports and activities. For that reason, we are going to limit indoor venues for K through 12 extracurricular events to the lesser of 4 spectators per student participant, or 250 ticketed spectators in total. We're also going to add, for other indoor arenas, a limit to the lesser of 10% of the seating capacity of the arena, or 1,000 attendees. As we think about the next step, ensuring the integrity of our healthcare system is of the utmost importance. From the beginning, we have said we are not going to eliminate and eradicate the virus. What we can do is everything possible to make sure that every single person that can get better with COVID gets the quality care that in fact gets them better. Going forward, in order to perform elective medical procedures, healthcare facilities, and this is in the existing executive order, healthcare facilities must reserve at least 10% of their capacity for treatment of COVID-19 patients. But I will tell you today that if things get worse and our hospital capacity becomes even more of an issue, this is the first place that I'm going to tighten. We've seen about the same compliance with this order as we've seen from the general population, wearing masks and avoiding crowds, which is to say, most are trying, but they're definitely not adhering to the letter of the rules. If we need to get more severe, eliminating elective procedures and stepping up enforcement will be the first step. All of these measures are important. And I hope that the people of Mississippi will make an honest effort to participate in helping slow the spread. I truly believe that most Mississippians are doing just that. I signed this order because I think that all of these things will help. However, I do not believe that policy handed down from the state executives has the ability to move mountains. We're going to see spread of COVID-19, and it's going to fluctuate, whatever words we write on the page of an executive order. If you don't believe me, you can look at states across the country. You can see states that have been exceptionally restrictive, and their COVID-19 numbers are going up. You can find states that have done very little in terms of restrictions, and their COVID-19 numbers are going up. It's going to fluctuate, whatever we do. All everybody can do is to take reasonable precautions. Wear a mask. Avoid large crowds wherever you can. Live your life while also being willing to protect yourselves and protect your loved ones. I don't believe that we can reasonably expect in month 10 of this virus. Honestly, we're pretty close to 300 days in to slow the spread. I remember when we were talking about 14 days to slow the spread, but we're almost 300 days in here in the middle of December. I don't think it's reasonable to expect individual Mississippians or individual Americans to be at home and at work, and that's it. But I do think that we can provide information for the risk of doing various events, We can put in place an apparatus wherein if everyone will do the little things, we can bridge this gap from where we find ourselves today. We can get to the point at which a large majority of Mississippians have the opportunity to get the vaccine, and I believe it will have an impact at the margins in helping us get to where we want to get. And that's what I hope this executive order that I've signed today will help us do. At this time, I am going to turn it over to Dr. Dobbs.
Thank you very much, Governor. Today, we are reporting 2,746 new cases and sadly 24 additional deaths. I would like to apologize for the erroneous numbers we released this morning. There was a data field issue where we didn't get birthdays for many of the patients, and it interfered with our automated portion of our deduplication algorithm. When we did our quality control measures by hand thereafter, we did find the error and have gone back and corrected that. But still, 2746 is a phenomenal number, but certainly glad it's not over 3,000. If we look at where we are in transmission for coronavirus, still we're seeing social events where people don't wear masks are the things that are most worrisome for transmission of coronavirus. We strongly support the use of masks in public settings whenever you're out and about, regardless of what county you're in. But please remember, we catch coronavirus from people we know and from people we love. It's going to be at home around extended family. It's going to be in church, and it's settings where we're not wearing masks routinely. So please, just for now, we're right at the cusp of having a significant number of vaccine, and it looks to be an extremely effective and safe vaccine, so we're really excited about that. Sort of shifting over to conversation about the vaccine itself, we do have what appears to be an early allocation of approximately 25,000 doses. We have within our plan, consistent with the advisory committee, CDC's advisory committee on immunization practice, to target frontline exposed healthcare workers. And the first distribution of vaccine will go directly to hospitals so that they can try to protect their most critical assets, their most exposed, but also at this time of significant pressure on the healthcare system, those that we just cannot live without for a couple of weeks in case they got sick, right? So that's where we're going to go. Thereafter, we plan on week 2 to have vaccine available for every nursing home resident and every nursing home employee if we get the allocations that we anticipate. And in tandem with that, additional doses, we will be continuing to supply healthcare and also supplying shots for healthcare workers who are not affiliated with health systems at our county health departments, and then we'll start working even to get supplies, hopefully to private clinics and pharmacies soon thereafter. Except for that first week, we still don't have 100% assurances of the doses we'll receive. We do feel pretty confident that we'll get at least that modest allocation maybe as early as next week. And Dr. Byers and I plan to be the first 2 in the state to get a vaccine. Dr. Byers and I are healthcare workers, just so you know. We both participate in testing locations and test people on a regular basis, so we are exposed. But also, too, we want to give people the assurance that we have faith in the vaccine. Now, we haven't received the complete EUA talking about the recommendation or the CDC's advisory opinion about it yet, but based on the data that we do have and reviewing the Pfizer data closely, we feel really, really, really good about it. Not only does it seem to be very effective, it shows about a 95% efficacy overall, but it seems to have good efficacy across age spectrum, right? So even if you're over 55, even if you're over 70, it looks like it's very effective. If we look at across race, it seems to be equally effective in Caucasians and African Americans, male and female. So we're excited about that. It exceeds our expectations. From a safety perspective, if we look, it's 44,000 people within this phase 3 trial, and they didn't see anything that was very concerning as far as like severe safety outcomes. Now, what they did see, and I think this is something that we can expect, is that if you get a coronavirus vaccine, your arm is going to be sore. And it's certainly a sacrifice that I'm willing to make. And it may well be that a significant number will feel a little bit achy or maybe a little bit fatigued for a day or so. And again, that's something that I'm perfectly willing to be part of. You know, a lot of us, like if anyone's had the shingles vaccine, I think it's pretty analogous to the shingles vaccine. But we know that part of the reason you're feeling those symptoms is because your immune system is learning to fight a new enemy. And part of that inflammation is it figuring out what the coronavirus looks like so that when you're really exposed, you can defend yourself. I would like to just make sure everybody knows that you cannot catch coronavirus from the coronavirus vaccine. There's no virus in it. It's just a simple piece of RNA that teaches your body how to recognize coronavirus. It is nanoparticles, which just means small particles. It doesn't mean anything more sinister. Nano just means small, so please be reassured. All it is the little snippet of RNA and a little ball of fat so that you can give it to somebody, right? If we gave you just the RNA, your body would chew it up before it had a chance to affect its immunologic function. But of course, you know, we've all heard about the 2 instances of allergic reactions in England. I haven't seen details of that. I'm not sure if it is in any way similar to anything they saw in the phase 3 study. We look forward to additional information. But certainly we know anyone can have an allergic reaction. So we'll see how that plays out with their recommendation for people who have severe allergic conditions to not receive it in England. But so far, you know, we'll wait and see what the data shows and what CDC says about it. But anyway, we're really excited about having access to the vaccine, and I'm excited to be at the front end of that. So thank you very much.
Thank you, Dr. Dobbs, for your efforts, and particularly over the last several weeks to month regarding the vaccine distribution plan. There's been a lot of conversation between he and I and our teams regarding that plan. I think probably one of the most important conversations surrounding that is the prioritization. Obviously, the CDC has very specific guidelines with respect to that, but when you start looking at those, the real conversation and discussion ultimately surrounds healthcare personnel and the most vulnerable population, those over the age of 65. And we would love to prioritize both of them at the very top of the list, and we will as the vaccines come out. But as you talk to a large number of healthcare providers, as we have done, one of the things that becomes clear to me is much of our healthcare constraints from a system standpoint surrounds not only the available equipment. We do pretty good there in terms of number of rooms and number of ventilators, et cetera. It's really around the constraints that we find ourselves with are really around personnel. And so as you can imagine, if you take the entire healthcare space in general and 5% or 10%, and you're already constrained and 5 or 10% are unable to come to work because either they have been exposed or they actually have the virus, well, that just puts more pressure on the system. So that's the reason we believe if we can get those healthcare workers with a vaccine, we'll have less absenteeism. Not that we're having an overly large amount, it's just part of it. We see it in everyday life. And so if we can do that, then that'll help minimize the real stress when it comes to existing personnel. And so that's the reason we'll start with healthcare workers and get to the more vulnerable population as quickly as possible. One of the things that I'm sure has been very obvious to all of you today is whereas there's usually 3 of us up here, there's only 2 of us. Earlier today, we did some routine testing, as we often do throughout our leadership, and Director Michelle could not be here because he did test positive on a rapid test for COVID-19. Earlier this morning, he is aware that I was going to mention this, so I'm not sure I'm constrained by HIPAA, but if I were, I wouldn't be announcing this were it not the case. We are certainly wishing him a speedy recovery, but I want you to know that even in these challenging times with basically 11 federally declared disasters that we're working at MEMA, that we have built a very strong team there, and Director Michelle is largely responsible for that team. And I want you to know that there will be no interruption of the outstanding work that is done by the Emergency Management Agency. Primarily right now, the work is focused on disaster recovery from Hurricane Zeta. The PPE and logistics delivery continues, and we know that the mark of a good leader is a good team, and Director Michelle is certainly a very strong leader for our state. We're proud to have him, and we look forward to him getting back sooner rather than later. So with that, I'm again going to thank everyone for being here today and open the floor to questions. Courtney Ann.
Governor, you're adding those social gathering limits to all the states, or to all the counties in the state. We've seen several invitations, have been sent copies of invitations for some of the receptions and parties at the governor's mansion. How is that not in conflict with the order, particularly for the one for the House of Representatives that has 122 members? What measures will be in place specifically, and how many different parties are you planning to host over the course of the next couple of weeks? Right.
Well, thank you for that question. And as I think about looking at those issues, what I would tell you is typically during the Christmas period, the governor's mansion, which is not only happens to be where the governor lives, it's also a museum. The museum is typically open, and literally, usually in any one year, 4,000 to 5,000 to 6,000 people come through it. And so, as we were looking at the opportunity for Mississippians to experience what has just the First Lady and her team have just done a phenomenal job decorating the mansion. What we ultimately came to is we canceled those events that we knew that we could not adhere to the requirements. We canceled, for instance, the Christmas candlelight event. Every first Friday in December, the Department of Archives and History hosts a very large event, which includes the old Capitol, also includes the new Capitol, and of course also includes the governor's mansion, in which they usually have several thousand people. So we had to cancel that event. We canceled this past weekend. My daughter turned 16 on Tuesday. She had a birthday party planned on Sunday night, and unfortunately we had to cancel or delay that event. But when I think about these upcoming events, what we did is we offered to the public, so anyone in the state of Mississippi, and quite frankly everyone in the state of Mississippi that chooses, has the opportunity to come and tour the museum at the governor's mansion right now. The way in which we've done it is we set it up with an online reservation system. The tours last for 30 minutes. They are limited to no more than 10 people over that 30-minute period, and everyone inside and indoors has to wear a mask. And so when we talk about these outdoor events, or these events that are taking place later in the day, later today, later tomorrow, sometime middle of next week, I don't know the exact schedule. What I think it does is it allows us to really send a message to the people of Mississippi that you can return to a life that is somewhat normal, but you've got to do it in a way that minimizes risk, that mitigates risk, that does things like ensures that we only allow 10 people indoors at any one time. And so what you'll see at our events over the next several weeks, in which we have invited primarily friends and family to a couple of events, but also those individuals that are statewide elected leaders or agency heads or certainly elected leaders in the House and the Senate, many of whom will choose not to come, which is certainly their prerogative. But we'll certainly open the mansion to no more than 10 people indoors. They'll be required to wear a mask once indoors, and then we'll also open the outdoors of the space outside the mansion as well. So they are completely in compliance with the order prior to us changing the order today. But all we did today is we took what was the 10 and 50 limits that were in those 54 counties to today and made that 10 and 50 limit to all 82 counties.
What about for the House, with there being 122 72 members, are you asking that they schedule specific times that they're going to be there? Because the invitation lists about an hour and a half time frame.
Yeah, so with that particular event, I would anticipate that a large number of them will not come. I would point out that probably half of them have already had COVID, but that notwithstanding, what we'll do is if we get to the point where there are more than 50 that have RSVP'd, we had always planned to treat those events in the same way that we treat those daily events, such that we will space them out and say your time slot would be from 5:30 to 6, or from 6 to 6:30, or from 6:30 to 7, so as to ensure that we continue to adhere to the guidelines that we put in place. Yes, sir.
Governor, Dr. Dobbs has been mentioning lately that Mississippi could see another 1,000 deaths, and just this week we crossed the 4,000 deaths total for throughout the pandemic. Do you think that the changes to your orders today will be enough to curb some of that increase in deaths here in Mississippi?
Well, I certainly will tell you that for any time any Mississippian dies is a tragic event. It is something that that we want to do everything that we can to minimize risk for the spread of the virus. There's no doubt about that, and we certainly believe that the measures that we've put in place are the right approach to helping us curb the spread of the virus. And if you curb the spread of the virus, you certainly lend yourself to being able to protect against more people getting sick, more people being in the hospital, and ultimately the more people who get in the hospital, unfortunately, the higher the number of people are that pass away. And so I think we're somewhat limited on what government can do in terms of certain things. I mean, you look at a state like California, which has basically been on lockdown since May, and guess what? Their cases are going up, and in many instances they're rising more rapidly than they are in those states that haven't had nearly the amount of restrictions. And so everything that we're doing has to be taken in concert, and quite frankly, there has to be buy-in by the people of the individual states. And what I would tell you is what we've seen throughout this pandemic is as more cases occur, we see a lot more people wearing masks. We see a lot fewer people gathering in large crowds. We see a lot more people want to get tested. Our testing demand is directly proportional to how many cases we have. Because if you know someone that has the virus and you even had talked to them on the telephone within the last couple of weeks, many people are like, okay, I want to go get tested, which is a good thing, because the more people that get tested, the more times we catch those who have the virus early and are able to put them and work with the Department of Health to put them in isolation, the better. Jeff.
Maybe a question for both you and Dr. Dobbs. Where would teachers and school faculty stand on the priority list for vaccinations?
So, 2B?
They changed the numbers, so it's kind of hard to know what it's going to end up looking like in that phase, because actually that caused some confusion. 1A, and anyway, it doesn't matter. So ACIP hasn't come out with their recommendations yet, right? So right now, obviously, we're looking at long-term care and healthcare workers. Makes perfect sense. It's very important right now. After that slice of folks has been immunized, as much as we can, there is a conversation about who's next. Is it essential workers or is it vulnerable folks? And I think there's arguments for both groups. And obviously, is it going to be vulnerable people who are essential workers? I mean, that's a whole other thing. But I'll tell you, it is our opinion, and I think most of us would agree, that if we look at essential workers and those who have sacrificed and have taken the most risk, we agree that teachers and people working in schools need to be at the top of the list of that essential worker sort of role. So, it'll be a lot of folks, but we want to make sure that they have vaccine as soon as it can be available for that level.
Let me just say this, because I don't think it can possibly be said enough. I met with our State Department of Education leaders sometime last week, and it should be stated that in Mississippi, just shy of 90% of all school districts have had in-person learning opportunities for their kids in the fall semester. Just shy of 90%. When I mention that to my fellow governors around the country, there's a large percentage of them, even in red states, that are just shocked by that. And if you look at what's supposed to happen when we go into January, the slightly over 10% of those districts that did not have that option, about half of those are actually going to be back in-person learning in January. I say that because the heroic efforts of our administrators, of our school teachers, we can't thank them enough. They have done great work. It is important that our kids were in the classroom. There are risks to it. No one knows that better than I do, personally. There are risks to kids being in the classroom, but there are also tremendous and significant risks to kids not being in the classroom. And it is my opinion that the risk for kids not being in the classroom is far greater than the risk to kids of them being in the classroom and learning. I will tell you that when I believe that it is warranted, I am the first to encourage our educators to do everything we can to raise the level of expectations, but I also want to take the opportunity today and just say thank you to every single one of them that have been in a classroom helping kids learn. It's going to make a difference in kids' lives, and there are kids across America that left the classroom in March of 2020 that may not be back in the classroom until August or September of 2021. And I'm here to tell you that 18-month absence, many of those kids are never going to catch up. And it is going to doom them to a lifetime of challenges. And in our state, we have significantly minimized the number of kids that fit that bill, and that is a huge credit to the men and women in our schools, and I want to personally thank them. We are literally 8 to 10 days from getting through the first fall semester. We had high school football, and while we certainly had challenges, we made it through, and we crowned high school champions in the last couple of weeks. A lot of people spent a lot of time and effort minimizing and mitigating risk through that process, and I want to personally thank you for it. Scott.
Talked about possible enforcement on hospitals if they don't provide the 10%. Talk about sporting events and limiting their size. Will there be an enforcement aspect of making sure that these events do adhere to those restrictions? Because we've seen football games where it was supposed to be limited, it sure didn't look like it.
Look, Scott, the fact is that I believe that the vast majority of individual schools they understand that the most important thing we can do in K through 12 schools is have kids in the classroom. And they also understand that it's important to have extracurricular activities. It's important to have athletic events, but the quickest way for us not to have our kids in the classroom learning is for us not to adhere to the limitations on crowd sizes at these sporting events, particularly when they're indoors. And so I don't think we'll get 100% compliance, and I certainly don't have the ability to send 3 or 4 law enforcement officers to every extracurricular event and make sure that they are complying. The fact is, right now, the vast majority of Mississippians are doing a whole lot to comply and to participate in our efforts. Nobody's perfect. Look, I haven't been perfect throughout this entire process, and when I've maybe fallen a little bit short, I've tried to come here and admit to it and tell you we're going to try to do better next time. That's what we're asking of the people of our state. Let's do everything we can as a group, collectively and individually, to adhere, to participate, to help us bridge that gap from where we find ourselves today to where we get where Dr. Dobbs was saying earlier, not where we have 50,000 or 180,000 Mississippians having received the vaccine and immunized, but where we're at 6, 7, 800,000, and that's within reach. That's within reach within the next 4 months or 3 months or 5 months, just depending on the time frame. But we've gone through a very difficult 10-month period, and I believe very strongly that that we're going to continue to see a lot of participation from people all across Mississippi. Yes, Jeff.
Back to Courtney Ann's earlier question, different way to ask that, maybe perhaps with Dr. Dobbs too. The only guy in the room with a medical degree has said numerous times here recently to avoid any non-essential gatherings. I think he had a list that, parties, receptions, stuff like that. You seem to counter that with you're having some receptions and parties, you've been to a fundraiser. Okay, the state chief medical officer appears to be saying one thing, you another. I mean, which is it? Should people avoid gatherings except for their closest family, or should they have Christmas parties and just be careful? What message should Mississippians listen to?
Well, I will tell you, throughout this pandemic, I have been very, very, very fortunate to have Dr. Dobbs and Dr. Byers as close confidants and as extremely competent advisors throughout this process. They have done tremendous work. And let's remember that they don't work for me. They work for the Board of Health. And so we could have had a very different relationship over the last 10 months, but they have been fantastic. Now, that doesn't mean that we agree on every single decision that has been made. And in fact, fortunately, in 99.9999% of those decisions, we have been able to find a consensus. There is no doubt that Dr. Dobbs would his job, and we talked about this earlier today, his job as the state health officer is to advise the governor, but also advise all of the people of Mississippi of the ways in which to act such that we can minimize and mitigate the risk of the spread of the virus. There is no question, and I agree with Dr. Dobbs in that the best way for that to occur is for everybody to stay at home, to drive to work by themselves, work, and then drive home. If everybody did that for weeks and weeks and months into the future, it would act to help slow the spread of the virus. I agree with that. As governor, I have to look at the public health impacts, but also a lot of other things that occur out there. And so what I think we are doing by offering the public the opportunity to, for instance, tour the governor's mansion, is to offer a sense of normalcy, but to recognize that you can have sense of normalcy while at the same time recognizing that the virus is real and that there are ways in which you can do things that also may not eliminate the risk of the spread of the virus, but you can certainly do it in such a way that you minimize and mitigate against the spread of the virus. I don't think there's any doubt about that, and there were several of you in the press that came by on Saturday while we were doing some of those tours, and you were able to come inside the museum part of the governor's mansion, and I think those individuals that were there in the media, what they saw is a very safe environment where every single person in there, both staff and the less than 10 people that were touring every 30 minutes, were doing so in a safe way. And so I don't think in 2020 there is not a perfect solution. There is not the perfect answer which, if we did X, it would drive down the virus to zero. The virus is going to virus. It is going to spread. But what we're trying to do is enact measures such that, and also provide advice. Enact measures where we have to, but also provide advice as here are the best ways in which to minimize and mitigate that risk. And that's what we've tried to do. I won't answer for you, but.
Okay, no, and And I will say that one of the things that's important to keep in mind is we have shown, I think, that we can work safely if we take those proper precautions, and that means wearing a mask in space and Zoom and all that kind of stuff. We're all Zoom experts now, I know. And then, we can do school. We can do the academic part of that. So everything, a lot of the stuff that the governor's talking about sounds like work to me. So I understand there's going to be some nuance in there. But having 10 folks over to having a beer, watch a football game, as much fun as that is, it's risky. Or having all your family come in from out of town and having dinner, it's risky. It's where we're finding transmission is in settings where people are not wearing masks. And looking at the CDC studies, what it shows is that people who wear masks in public don't catch it in public; they catch it at home, which is not surprising. So right now, although I think masks are extremely important, it's really important to reinforce that message of, hey, let's pull back for a little bit, because I really do think that if we can get enough vaccine out there, we can get through the holidays. I think we can round the corner on this thing. But it's going to take a combination effort. If we can push it down, let our kids get back into school into the winter, right? We want our kids to have a successful start of school. So part of that is not letting it transmit in the holidays. Get some vaccine, especially in our vulnerable folks, so we're not going to overwhelm the healthcare system, right? So we're going to get that block of folks. We're going to be dealing with this for a while, but I'm hoping what we're dealing with in January and February is quite a different situation than what we're dealing with right now. So I do have a good little bit of optimism, and I look forward to going out with my friends. I'm like the ultimate party killer, and so I won't go anywhere because I'm like I'm like no one wants to have me anywhere, and I wouldn't go anyway. So anyway, I'm ready for this to be over.
Yes.
Hunter Dawkins with the Gazebo Gazette has a question.
Thank you, Bailey. Thank you, Governor. Quick question for you, Governor. Since yesterday, Long Beach High School closed down, they went to virtual learning until the end of the semester, I should say. They also canceled all of their athletic events until the next year. My question, even though it's early on in basketball season, I know that if they follow the same guidelines as they did during football season, some of those conference games in the future may be canceled depending on the situations work out. How is that is there any type of enforcement for the MHSA, for yourself to be able to get involved with that? Do you mind just talking to me about that for a second?
Yeah, well, thank you, Hunter, for the questions. I don't think I'm going to get involved in specific decisions related to individual basketball teams and conference games, et cetera. What I will tell you is if there is enough virus, and I don't know the specifics of what's going on at Long Beach High School, I must admit, but if there's enough people with virus that they felt like, again, a local decision, that they needed to go all virtual, then I think it's certainly a prudent decision to delay athletic events as well, because if there's enough of the positive cases within the community that they shut down the classroom, even for a short period of time, then I think it certainly makes sense that they would not have athletic events at the same time. In terms of what that looks like in terms of conference games, et cetera, I don't know all the specifics, and so but I will say that I do think it's important to not only keep kids in the classroom if at all possible, and also give kids the opportunity to compete on athletic playing fields. Virgilio.
Dr. Dobbs, do we know where the vaccine is coming from, whether it's going to be Moderna or Pfizer? And is the Department of Health set up to distribute the Pfizer version, since that's required?
Absolutely. Something we've been thinking about for a long time, especially these cold chain requirements, right? So the first allocation will certainly be Pfizer, and then hopefully, if things continue, we might get some Moderna later in the month. We do have a allocation plan that will get it to some hospitals directly, and some hospitals we will redistribute it because it comes in a minimal sort of $1,000 dose sort of package. And so there's some logistic complications with that, but we've got a plan, and we'll get it to folks really quickly. One of the things that we've worked out quite nicely with our MEMA and National Guard partners is our logistics operation is fabulous. And so we have a lot of confidence that we can hotshot, et cetera, to get folks what they need quickly.
And I would just point out again, from a logistical standpoint, second to none. Mississippi is as good as any other state. And it's because our MEMA partners, our National Guard team, and our Department of Health are in constant contact. They work very closely, and they have one goal and one mission, and that's to get the job done. And they, obviously the MEMA and the Guard reports through the governor. The Health Department does not, but we have been on one page throughout this process, and we are in far better shape. And by the way, I think we'd all agree, were it not for the nearly 1,250 National Guardsmen that we have on orders helping us, we would not be able to say that. And so the huge kudos to those men and women who wear the uniform that have helped us do that. Yes.
Nick Juden with Jackson Free Press has a question.
Hi there, thank you. I'm going to have one quick follow-up after this. Governor, last month you called the state's top medical organizations so-called experts when they called for stronger executive orders, suggesting that a statewide mask mandate was their silver bullet, which is not true. Last week you belittled the leadership at UMMC for calling for help now that their hospital is overflowing, saying that their warnings shouldn't have the impact that they do. Here in the height of the pandemic, why do you undercut the expertise and messaging of the doctors on the front lines of this fight?
Well, Nick, thank you for the question. I will point out that you use a lot of words and a lot of terminology that I have never used, and so that is certainly, you're certainly entitled to your own set of opinions, but you're not entitled to your own set of facts. And so what I would tell you is that we have a large number of healthcare professionals throughout the state that are working very hard every single day. The vast majority of hospitals in our state and the vast majority are functioning and operating in such a way in which we are providing the care that is necessary to treat COVID patients. This is an unprecedented time. This is a year in which we really haven't, we've never seen anything like this before, at least not since 1918 in the United States. And so it's challenging. We're all making difficult decisions on the run. I agree with what some of our some individuals say and don't agree with others, and I'll certainly let the people of Mississippi know when those times are different.
How about this? Will you commit to visiting UMMC and seeing firsthand the unbelievable stress on its emergency department, med-surg units, and ICUs?
I will certainly be in contact with healthcare professionals throughout Mississippi, as I have been since the very beginning of this pandemic. We've got some real heroes out there, and what I would tell you is that I certainly appreciate all of the work that's being done by the nurses, by the docs, by the respiratory therapists and others that are treating COVID patients, but also by those individuals throughout our healthcare system that are treating non-COVID patients, because as the stress of the number of COVID patients increases, it makes it even harder also on those individuals who are working on non-COVID lines, because they have less backup and more people are dedicated to the COVID lines. Yes.
You mentioned, or both gentlemen mentioned the fact that Pfizer is going to be providing us with the first doses. Earlier this morning, one of the networks, one of the CEOs of Walgreens was speaking about their capacity to help distribute vaccines. Are they going to be involved with this? And if so, are they set up, have you all checked, has the Department of Health checked, to see whether or not they actually are able to handle the Pfizer or Moderna or whatever else might? Because as I understand it, there are still several other companies that are working on providing their version of the vaccine.
Yeah, so I'm really glad you brought that up, because we're very excited to have their help, especially early on with the long-term care settings and the nursing homes. It's actually through a federal program that coordinated with Walgreens and CVS in Mississippi to vaccinate all the long-term care locations and the employees. So they're going to take that mission, which is great, because then it lets us take on the other missions. Thereafter, we have hundreds of locations already signed up to be vaccine distribution locations. For some locations, the Moderna is going to be a little bit easier, but we have every indication that Walgreens specifically should have no issue with the Pfizer vaccine storage issues. You don't only have to have a freezer. You have to have the capacity and the access to dry ice, and we also have backup plans for additional dry ice if we need it in Mississippi. We've got plans and backups for the backup plans.
I would just also point out, I try to do this every time because I think it's yet another way in which to shine the light on the great things that are happening in our state of Mississippi. The Pfizer vaccine, by and large, is being distributed by Pfizer. The Moderna vaccine is being distributed largely through the CDC and a relationship that they have with McKesson. McKesson has 4 facilities around the United States, 2 in Louisville, Kentucky, and 2 in and around Olive Branch, Mississippi, that are distributing this vaccine. Almost 2,000 of our fellow Mississippians will be actively involved and engaged in the distribution, not only in our state, but around the country. And that just highlights the fact that even in the middle of a pandemic, major corporations are choosing Mississippi to invest capital and to hire employees. And I'm certainly very proud of that fact.
Hey, Governor, thanks. I'm kind of shifting gears a little bit. I was wondering if you had a comment on the recent lawsuit Attorney General Fitch joined with Texas regarding the integrity of the presidential election.
Yes, thank you for that question. I had the opportunity to communicate with General Fitch over the last couple of days, and we certainly appreciate her active nature by filing a friend of the court or an amicus brief in support of this particular suit. And in essence, and I think this is important, because this year, and this was attempted here, but they didn't have much success. A couple of things happened this year. In many instances, those on the left, particularly liberal groups, first tried to get legislatures to change election laws so as to allow for very different election systems than what those states have run in the past. In some instances, they were successful in doing so. They were successful in convincing some states, for instance, to allow for significantly more mail-in voting. They were successful in allowing some legislatures to significantly change the way in which absentee ballots are done in their state. Now, fortunately, Mississippi, we didn't do either one of those things. I want to commend our legislators for their stance on that, particularly Senator Branning and Representative Beckett, the 2 chairmen of the elections committees. They did not take steps that were taken by some in legislature, some of which may have even been controlled by Republicans, to drastically alter the way in which people vote. Well, in those states in which these far-left groups were unable to convince legislatures to change the way in which the ballot system works, they then sued, and they went to court, and in some instances state court, in some instances federal court. And in some of those lawsuits, they got some officials in the state to agree to various things which changed the way in which elections were conducted in those states. Well, in the United States of America, the only changes to laws have to be enacted by legislative action. So whereas I would not have supported the actions that some legislatures took in various states, at least that's the proper place for those changes to occur. It is not the role of the federal court, nor is it the role of state courts to change election laws in those states. And so that's, in essence, what the litigation that Texas filed is seeking to review. And I think it certainly makes sense for all states to join in, and the court should rule on whether or not these changes in election laws that were enacted in the courts were a constitutional act or not. That's the proper role of the federal bench, and quite frankly, that's the proper role of the judicial branch of government in these United States.
Eric Walker from JSU TV has a question.
Great.
Hey, good afternoon, everyone. Hope you all are doing well. My question is for Governor Reeves. It centers mainly around the economics of the crisis. We're getting information that the next stimulus package may include eviction moratoriums up until February, and about $25 billion in rental assistance. That's on a national level. I guess wanted to get your overall thoughts on the back and forth with those talks, firstly, and then secondly, as you know, we did a $20 million rental assistance program here in Mississippi. Is there any way we can get the numbers on that? How many landlords it helped? How many tenants that it helped? And overall, Governor Reeves, do you think it was enough?
Yeah. So, well, thank you for that question. I don't think there's any doubt that with Primetime being the head football coach at Jackson State, it's going to keep all of us on our toes going forward. I'm certainly happy with the notoriety and the publicity for Jackson State that Deion Sanders has brought over the last several months. When you talk about the federal package, there's lots of conversations that are occurring internally. We have been involved in some of those. And what I would tell you is it's hard to speculate on any one provision that may or may not be in an additional stimulus package due to the fact that it changes almost hourly. And so what I would tell you with respect to the rental program, we actually had two rental programs that were put into place. We utilized federal resources to use the Mississippi Home Corp to institute a rental assistance program very early on in the pandemic. The Mississippi legislature in, I believe it was September, maybe October, then instituted a second assistance program that they allowed for the Mississippi Development Authority to administer. And I don't have those numbers in front of me, but we will certainly, I'm going to ask Bailey to get that information to you. We'll reach out to MDA and get the specific numbers on where we find ourselves, and we'll get that information to you, Eric. Thank you for the question. Yes, sir.
This question's for Dr. Dobbs when it comes to the vaccines. We're only getting 25,000 doses in this first round, and they're going to be going towards healthcare workers and long-term care residents. Can you talk about how long is it going to take for those people to start to see like the efficacy in their lives, and what is the impact going to be in terms of the greater community?
Yeah, so we'll get 25,000 doses, and those will go simply to healthcare folks that first week. Whenever we get with long-term care, which is going to be sort of like that next distribution, that's going to be more. So there's more after that that's going to go for long-term care. Based on the data so far, it looks like that after about 7 days, you start to see some evidence of developing immunity, and then after one dose, it looks like from the data that about 82% of folks will have immunity or protection, and then you go forward. So it'll be great. Well, actually, after 7 days, we'll start hopefully seeing some protective benefits that'll help us through the month of December, not having to wait until mid-January before we see some benefits. So, hopefully it'll help, reinforce the structure of our hospitals and health systems to make sure we can maintain that capacity. But once we get into long-term care settings, there are a lot of benefits to that, right? So we know because of the high mortality, the high hospitalization rate, and then just really the outbreak scenarios that we have that are so very disruptive, not only to the health and well-being, but also for the capacity of people to visit their family, how important that is. So the impacts for the long-term care setting may be very important. We want to make sure we reassure the residents and also the families of people who have family in long-term care that the vaccine's worth doing it, right? They've suffered immeasurably by having to be locked down, but also from the illness, and this is an opportunity for them to get past that.
Yes, sir.
A follow-up to that, to some degree. In the past, there have been a lot of scams regarding what you could use, what you could take. to help fight off COVID. Is the state prepared through the Attorney General's office, through Department of Consumer Protection, to watchdog to see if anybody is bringing in these, holistic Moderna versions or Pfizer versions or whatever? Because it seems to me when you have that limited a number, somebody's bound to go out there and try to come out with a phony version.
Well, get it from a trusted source, right? I mean, your doctor, the health department, your hospital, that's the only place it's gonna be, and your pharmacy. There's not gonna be a guy on the street corner, with some COVID vaccine. Use trusted sources. Wherever you would get medical care, that's where you need to get your COVID vaccine. So we'll try to make sure that, and if we see stuff like that, we'll try to, break that down pretty quickly. And if the AG's office needs to get involved, we've worked with them on some other things. There's already been some marijuana scams going on, so we'll get with those guys.
Yeah, I have full confidence that the health department, in conjunction with the Consumer Protection Division of Attorney General Fitch, we will be on top of that, and we will prosecute any cases that are necessary. I have full confidence of that. Yes, Court.
Question for each of you, healthcare specific. Dr. Dobbs, I know that last week we talked a little bit more about the lack of ability to transfer and things like that. If you could just kind of update us on what the hospitals are looking like. I know it may not have changed much since we last spoke. And then, Governor, for you, I know that Nick asked you about whether you would visit UMC. Can you tell us whether or not you have been in one of the hospitals in the state since the pandemic began and had a conversation within the hospital setting, not just with upper management? And if not, if you plan to do so.
Yeah, well, I was actually in the university hospital within the last 10 days on a visit with one of my kids. It's one of those sticky issues because if you'll recall, there are a whole lot of people who have family members in all of our hospitals that are not allowed to visit them because most hospitals across Mississippi right now have limited visitation and in many instances don't allow visitation at all. I know of one scenario within the last several months in which, let's just suffice it to say, someone that if anyone could get in to see their loved one, this person would have been able to, and they were unable to get in because of those restrictions. And so I certainly don't want to put anybody at risk by being in a facility. But we have had many conversations with healthcare workers, many conversations with executives, many conversations with physicians. I don't know how many times I've been on the call that Dr. Dobbs does every Friday afternoon with State Medical Association. I've done that 3 or 4 or 5 times. I don't know exactly how many, but yeah, I mean, we've had many of those conversations and they've all been helpful. We don't agree on every single thing, but they've all been helpful to have those conversations and certainly the task force that we put in place has done a remarkable job preparing us for the worst case scenario.
We continue to have struggles. We do communicate with hospitals and leadership on a regular basis. What we're seeing now is, so we see a lot of health systems are foregoing electives and trying to make space and stuff. So what they had asked is for them to be able to manage that on their own. And certainly understand that they can be more nimble. One of the challenges what we're seeing right now is smaller hospitals, when they get a sick person, getting them where they need to get quickly. And that's something we're going to have to master. Some of the local health systems have coordinated amongst themselves, and that's great. We want people to solve their own problems, and I've heard several instances of that. But we may have to go to a system within the system of care plan that mandates rotational, yeses, right? There's somebody in a small hospital, you're full, too bad. That sort of thing. So you got to take them, figure it out, and then the next hospital's up. We got to protect people as much as we can. But again, I just want to reiterate: healthcare is an expendable resource. At some point, people may ask, "What are you going to do next?" I'm saying, "There's nothing else to do." Right? I mean, are we going to? So just please understand, we got to turn off the spigot. We can't just keep using the mop.
And today's numbers, if that 15% average held, that's another 411 patients. If the hospitals are already kind of where they stand now, what are the hospitals telling you?
We had 172 admissions yesterday, which was another record, right? We have a total of 1,166. Remember, that's a record too. 1,008 was a record not too long ago. So they're doing a good job. I think the management of patients in the medical floors is a lot better, and keeping them out of the ICU. But if you, we had some information I shared earlier today that shows a pretty frightening shift from younger folks to older folks, and that translates into more people getting more ill. So we got a ways to go on this, and it may get more difficult.
Let me just talk a little bit about that from a quantitative standpoint, and that's the reason I mentioned earlier the potential mandatory elimination of elective surgeries in certain regions of the state, because we've got some regions that are everyone's self-managing. Some regions, it appears, are self-managing better than others. But just to put things in perspective, if you go back to early June, Mississippi had approximately 700 people in ICU bed in the intensive care. If you go to the peak of this crisis in, say, late July, early August, Mississippi had approximately between 740 and 750 patients. If you go to where we are today, we have approximately 760 patients in the ICU. So what you see is a relatively constant number over much of 2020 in terms of total patients in the ICU. But if you look at non-COVID patients, if you look, say, something like back in that August time frame, we got down to 422 non-COVID patients in the ICU. When our COVID numbers came down, elective surgeries went up, and we found ourselves with 582 non-COVID patients in the ICU. And so while total patients in the ICU over the last 4 or 5, 6 weeks really hasn't changed, what you find is 582 non-COVID patients, now it's down to about 430. And so that's part of the management process of the individual hospitals managing it themselves. That's the reason that 10% that's in the executive order is so important, because it allows them, and we'd much rather them manage themselves. That's a better system for everybody. And overall, what you see here is we've seen significantly fewer non-COVID patients in the ICU as a higher number of COVID patients in the ICU as that continues to rise. But the overall ICU patients, because as Dr. Dobbs has said repeatedly, every year, this time of year, without COVID, we have ICU capacity issues in various hospitals. And so it's a management tool and a management issue, and there's no perfect answer, and there's no easy answer. It's just you got to continue to monitor it and manage it. And what you see is literally from October of 580, a peak of 580-ish total non-COVID ICU patients down to today. I can't read as good as I used to could, but 495, I believe. Yes, sir.
Governor, is protecting the state's healthcare system still our primary goal?
Yes.
And to follow up on that, do you see any other actions in the future that will go to protecting the state's healthcare system, as we see so many hospitals across the state strained? Even if we do have a lot more non-COVID patients, they're still just operating at or beyond capacity.
Yeah, no, as I mentioned earlier, I think the most likely next action, should it become necessary, is an executive order that limits either by hospital, by region, or ultimately statewide, if that is necessary. I don't think it is at this point, but limiting elective surgeries. That's one thing that we have not mandated that through executive order. We've mandated that capacity is allowed in every hospital, up to at least 10% of their capacity for COVID patients. But we can we can, through executive order, should we choose, limit elective surgeries. We do not want to do that, but I think it is a fact that if there are no elective surgeries, there will be less non-COVID patients in ICU, which will free up capacity.
One other quick question.
Sure.
Are Are you going to be taking the vaccine in this first round? And if not, will you be taking it when you do become qualified for it?
I am certainly willing to take the vaccine. I've got to talk to my chief medical advisor over here as to when I am eligible to take it. But as soon as I am eligible to take the vaccine, I have every intention of doing so. By the way, I'm tired of COVID. I'm ready for it to go away. I know there are a whole lot of people in Mississippi that feel the same way. And I think the more people who are willing to take the vaccine, the more quickly we can get back to a more normal scenario. And I just can't tell you how, I mean, tomorrow, tell me if I'm wrong, Dr. Dobbs, but I think tomorrow is Thursday, and I think Thursday is when the real smart people around the world meet and determine if this vaccine is going to get the emergency use authorization. So this is a big time in the fight against COVID.
Yes, sir, you're right. Tomorrow, FDA Advisory Committee meets, and then ACIP will meet after that.
Yes, sir.
With the election theoretically being over, President-elect Biden has said that in the first one of his first acts would be to establish an executive order that would require the citizenry of the United States to be masked for 100 days. You have avoided doing that statewide, but rather allowing the counties to mandate their own until it gets to the point where they can't, where the numbers start rising and you feel you have to step in. Are you going to honor his request?
Look, I hope to have the opportunity to work with the Biden administration. I think it's important that we work with them. But since you asked the question, I was just terribly disappointed with what Vice President Biden said yesterday, which was going to be his approach to the coronavirus. He recognizes that the president doesn't have the ability to implement or even do anything other than suggest a mask mandate. What he can do and where he can have an impact is he can mandate that federal workers, when they travel, wear masks. He can mandate perhaps masks amongst interstate travel, but he doesn't have any authority to tell a Mississippian what they can or cannot do. But I just found it absolutely shocking that the national press did not push back exceptionally hard on him when he said his plan for the first 100 days was 100 days of mask. There are 40 states in America right now that have a mask mandate. So in terms of a practical implication of changing the course and the direction of the virus in America, that's going to have virtually no impact. The second thing he said he was going to do in the first 100 days is that he was going to be for the distribution of 100 million vaccines. If we don't have a president of the United States for 4 months, January, February, March, and April, for the first 100 days, we're going to distribute, as Americans, at least 100 million vaccines. He's going to have absolutely no impact on the virus. And so, it's just almost shocking to me that he spent the entirety of the campaign focused on attacking President Trump and his handling of the virus. And three things he says he's going to do in the first 100 days are going to have zero impact on the virus and where it finds itself. Zero. None. And so it's very disappointing, but not surprising, because the fact is the impacts for the virus, number one, in terms of getting it under control by the administration, has already occurred through Operation Warp Speed, and the creation of and ultimately the distribution of the vaccines, many of which will have started and the plans will have been approved across the country long before the middle of January.
Is the state further ahead with education, since we have, even though some of the school systems are having to go back to virtual learning because more cases are appearing in their classrooms and in their students, is the state ahead?
I would argue that Mississippi, relative to many of our peers around the country, is in a far better position in pre-kindergarten through 12th grade and the progress that has been made here than virtually many states around the country. And that's just anecdotal in talking to my fellow governors and hearing the number of students that they have in classrooms and things such as that.
Your Christmas.
Yes, ma'am.
Your Christmas holiday party that's scheduled for later this evening. Do you mind if I ask how many invitations were sent out?
I don't mind at all if you ask, but I can't answer. I don't know the answer. But my thought is, I think I was told in terms of the number of RSVPs, it's this tonight's somewhere in the neighborhood of 15 or 20 or something like that, 25. It's most of these are very small, with the exception of some of the legislative events. But again, the total number of sending an invitation through the U.S. Postal Service isn't going to have any effect on whether or not someone gets COVID or not. It's the number of people who attend and how they attend, and are they spread out, and are they wearing masks, and are they ultimately socially distanced. But tonight is a particularly small one, so I don't know the exact number of who has RSVP and who hasn't. That's way over my pay grade. The First Lady handles all that.
Governor, do you or Dr. Dobbs, do either of you have concerns that
Yes.
people, I know, that people will see and hear this conversation today? You said that you hope that it will show that there can be a sense of normalcy brought back, but with the precautions. But maybe they say, well, hey, I've got a work party that I need to have. You know what, if the governor's having it, if I can make these restrictions, and they maybe aren't following quite as closely, do you worry that they'll view it as a rules for thee and not for me?
I don't. I think if you listen to Dr. Dobbs talk earlier about the social gatherings, where we all get comfortable in our own surroundings, particularly when we're around friends and family. And so when you think about that, and you're gathering around to watch a football game, and it's 15 or 20 of your closest friends, first of all, if none of the 15 or 20 have the coronavirus, then no one's going to get it from you, right? And so back 3 or 4 months ago, when there was much less, when the numbers were much lower, then there was a much lower risk that even if you got together, that you would spread the virus knowingly or unknowingly. Well, now that the numbers are up a little bit and are really up at this point, and I made a very valid point last week that we had not yet reached in terms of number of cases, we had not reached where we had been in August. That's not true anymore. Now we are, in terms of our 7-day average, we are well beyond where we were back in August in terms of total number of cases. And so my message to everyone is, my view is, if we sat here and I signed a sheet of paper or tried to convince you that, look, you get up, you go to work, you drive home, and you do nothing else. Well, people at that point, I think, are going to say, well, I just can't do that. And so they not only quit participating in that, they quit participating in everything. And so what I'm trying to say to the people is, if you're going to do certain things, there are ways in which to even do certain things which may not be the highest priority list for Dr. Dobbs or the public health experts, but even if you're going to do certain things that they would prefer you not do, that there is a way to do it more safely than other things. And so, for instance, you could have a party of 10 and not, which meets the criteria, but if you don't wear a mask and you stay indoors and you huddle up, then the risk of transmission is relatively high. And I think what we have talked a lot about internally is being around close friends and being around close family. People tend to let their guard down. So a lot of people who are doing great things in the community, when they go to, I talked to a friend of mine the other day that may have, that had tested positive. I hadn't seen him in a while, but I talked to him on the phone. And this is what they said to me. They said, Tate, I had gone to Walmart, and every time I go to Walmart, I wear a mask, and I don't get anywhere near anybody. I am vigilant about it. But then I had a little, card game at my house, and someone had it, and of course, you're sitting around with people that you know and you like, and you're used to sitting around with them, and they just let their guard down. It's not intentional. It's not like they're, oh my gosh, I want to go get COVID. It's just those social settings where we're overly comfortable, we tend to let our guard down. And that's me. That's probably you. You can probably think back to times, and it happens, even, and by the way, there is no magic number to 10 or to 20 or to 25 or to 50. Even if you are perfect, if you're married, ask yourself, do you wear a mask every time you get done with work and you go home? Do you wear a mask around your spouse? Highly unlikely. And so the concept is the same. You get in a setting in which you are comfortable, and you tend to let your guard down. And oftentimes you do it without even thinking about it or without even realizing it. And the key to the smaller numbers and the attempt at smaller numbers is if you do it in your household and it's just you and your spouse, if you have it, knowingly or unknowingly, and it's just the two of you there, you can only spread it to one person. If there are 5 people, you could potentially spread it to 5. And so it's oftentimes just simply letting your guard down. I don't think there are very many people in the state that are intentionally going against. There are a few. Y'all probably hear from them. There are a few that just know what they're smarter than everybody else, and that's okay. But most people are trying to do right. And so what we're trying to minimize is the people who are trying to do right that find themselves in a setting in which they just accidentally let their guard down, and then boom, we end up with a few cases, and then it spreads exponentially at that point. So again, nobody's perfect. Nobody's gonna get this thing done right every time. And by the way, I mean, let me just say, and I mean this, I've said it a lot. One of the more frustrating things about 2020 for me is the mask shaming that has gone on. It's gone on both sides. I shame you because you wear a mask, and what are you scared of it? And then, you shame somebody else because they're not wearing a mask. We don't have to do that. We're trying to identify risk and let people know. We don't have to pick on each other. We don't have to tell everybody that they're stupid because they won't do it this way or that way. We're just trying to lay out what we believe to be the best course of action to minimize risk, to protect the integrity of our healthcare system, and ultimately to get us over that bridge to where a reasonable number of people have a vaccine. Did you have a follow-up, or did you have something for Dr. Dobbs?
I was just going to say, it's a risky time to get together. If we look at that number of people who are going to be actively shedding virus on average right now, if you go to a party of 10 people, just on average, right, there is a 19% chance that somebody there is going to be shedding virus, right? And if it's 20 people, it's about 34%. So not that you're going to have contagious every time, but this is a dicey time to be getting together. And if people aren't wearing masks, people are just not wearing masks at family and social get-togethers. They're just not. And that's what's very important. The other thing I'm going to add is I'm just saying, it's not just up to me and the governor for this to go well. It's up to everybody. And I'm proud to see other local leaders, mayors, et cetera, making hard decisions that are unpopular to protect their constituents. That's real bravery, and I appreciate them doing it.
Yes, sir.
Governor, this year, a lot of Mississippians are not going to be spending holidays with their family, whether it be they're in a higher risk group or they are just concerned about other family members. You mentioned earlier that your daughter and your family chose to forego that birthday. What was the conversations you had with your daughter leading up to that decision? And what are some things you would tell parents who are talking to their children about how we might not be able to see grandmother and grandfather this year?
Yeah, well, I'm not going to repeat that conversation, but what I would tell you is, everybody's got to make their own decision, and that's the thing that I've been saying from the beginning. This takes everybody, and look, and I think this is important, and we all have to remember this. The vast majority of Mississippians are doing good work. Even on a day like today where we had 2,700 new cases, okay? 2,700 new cases. That's a big number relative to where we came from. But we have 3 million people in our state, and about 160,000 of them have contracted the virus. And then there's another subgroup that has contracted the virus but not tested positive. But what that means is, even with all those numbers, there were 2.8 million Mississippians that didn't get the virus today. And a lot of them didn't get it because they made good decisions. And so the only thing I would say is everybody's got to assess their own risk level. And if you choose to do things that put you in a position in which the risk is higher, that's just, people have to make personal decisions. But I trust the vast majority of Mississippians to make good decisions most of the time. Nobody's going to be perfect, but I trust them to make good decisions most of the time. Yes.
Caleb with the Daily Journal has a question.
Yes, two questions. One for Dr. Dobbs, it's pretty straightforward, and then I'd like to ask a question to Governor Reeves. I asked my question for Dr. Dobbs first. You have said a couple times this afternoon that you anticipate 25,000 doses in the initial allocation of the Pfizer vaccine. Since this is a two-shot vaccine, I take it then that only half as many people as 25,000 can be vaccinated with those doses. Is that accurate?
No, sir, that's a good question. We have 25,000 doses available for 25,000 people, and the federal government has set aside another 25,000 for future use. So this is 25,000 people that we plan to get vaccinated within that first week.
Okay, and then for Governor Reeves, just wanted to follow up. You have emphasized today and throughout this pandemic response that in order for your executive orders to be effective, there needs to be buy-in, especially from local leaders, be that at the municipal or county level. But across the state, we've seen some, maybe not a lot, but some, especially sheriffs, say they will not enforce your orders, and maybe a few go further and say they don't think you have the authority to issue the orders that you have had. What would you say to those officials, and you have concern that statements like that undermine community buy-in from people who are hearing about what you have ordered?
Yeah, well, I really don't understand, Caleb, why you choose to ask Dr. Dobbs the straightforward question and then try to ask me the hard one. No, I'm just kidding. Look, Caleb, the fact is the vast majority of Mississippi elected officials, be they Democrats or Republicans or independents, whether they are at the municipal level, the county level, or even at the legislative level, have worked really, really hard this year to get buy-in from their constituents, from people all around Mississippi, and I really, really, really appreciate the hard work of officials all across Mississippi in dealing with this unprecedented virus, the likes of which we haven't seen in this country in 102 years. I mean, for those individuals that don't want to participate in COVID, I kind of sympathize with them. I don't want to participate in COVID anymore either, but I don't have that luxury, and I don't think the people of Mississippi have that luxury. We've got a gap here from where we find ourselves in mid-December to over the next several months when we can get an adequate number of people that want the vaccine, and I'm very, very hopeful that we're able to minimize the spread, protect the integrity and health of our healthcare system, get a high number of people vaccinated, and then we can get back to a more normal life. Bobby Harrison? We're running light on top.
Bobby, do you have a question?
Looks like Bobby found something else to do. We've been doing this for an hour and a half. I do appreciate everyone. Oh, okay.
Just a real simple follow-up for Dr. Dobbs based on Caleb's question. That first batch could come as early as next week, if I understand correctly. And you mentioned the second batch will be for long-term care residents. When can we expect that? I know you can't give me specific, but just in ballpark terms.
You know, a week or so thereafter. You know, we don't know for certain, but we hope that a week after our first allocation for the healthcare workers, that we'll go ahead and pull the trigger on the long-term care operation 1 week later, more or less. You know, that's kind of a soft soft date, but that's our hope.
And Bobby, just FYI, the key day is tomorrow. If the emergency use authorization is approved, the clock will begin once that occurs, whether it's tomorrow or Friday or Saturday or whenever they ultimately approve it. So that's when sort of the clock starts ticking and shipments go out. So again, I want to thank everybody. This has been a very long press conference. A lot of good questions. I appreciate every single one of you for doing your job, sending the message to our people that we are needing to bridge this gap over a few more months, and hopefully we can see the light at the end of the tunnel through this vaccine. So thank y'all. Stay safe out there, and God bless.